The number of coronavirus patients to die in UK hospitals has risen by 10. All the reported fatalities were in England, with Wales, Scotland and Northern Ireland confirming no COVID-19 deaths since yesterday. Those who died were aged between 67 and 91, with all but one person who was 85 having known underlying health conditions. It comes amid growing concerns over rising infection rates, with 22,961 new cases confirmed by the Department of Health yesterday. There were a further 33 coronavirus deaths reported yesterday in all settings, bringing the official death toll to 42,350. The Welsh Government today confirmed 596 new infections, while there were 697 in Scotland. A UK-wide figure will be released later today. Of the hospital deaths confirmed today, NHS England said 4 were in the North East and Yorkshire, 3 in the North West, 1 in London and 2 in the Midlands. Public Health England was last night forced to admit it had not included more than 15,000 new cases in its daily figures amid soaring infection rates. Latest figures reveal that Manchester has their highest infection rate in England, followed by Liverpool and Knowsley and Merseyside. Public Health England last night admitted 15,841 cases were left out of daily reported figures between September 25 and October 2. Now it has emerged the cases were not only missing from statistics, but also from vital contact tracing efforts led by the outsourced NHS Test and Trace. FE insisted every person who was tested initially received their test result as normal, with all those testing positive told to self-isolate. But Test and Trace and FE Joint Medical Advisor Susan Hopkins admitted all outstanding cases were immediately transferred to the contact tracing system by 1 a.m. on 3 October. And a thorough public health risk assessment was undertaken to ensure outstanding cases were prioritised for contact tracing effectively. The delay suggests cases were not referred for test and trace contact tracing until Saturday, which is up to a week after some of those involved took a test. That would mean people they mingled with just before testing positive could have already become infectious and spread the virus without knowing it. Leaked documents claim ministers grappling with rising coronavirus infection rates are weighing up new 3-tier restrictions to tackle confusion. Under the proposed traffic light system, all areas in England would be assigned a colour, with toughest restrictions in red areas. Pubs and restaurants in the worst affected places would be forced to close again, and people would be banned from mixing with other households. A draft document seen by The Guardian says the system would simplify the swathes of restrictions currently in place across the country. Each area in England will be assigned a traffic light colour red, amber and green with rules set accordingly.